Varied irritable bowel symptoms. Variation which will assist irritable bowel syndrome. Irritable bowel syndrome is one of the syndromes which really need the help of doctors. Moreover, 10% of the population are reaching the main hospital with this condition. Actually, this condition explains 10% of all main hospital visits. While it is only among the common disorder, people never use to talk about the syndrome. Mainly it is branded by symptoms like gaseous belly, bloating, diarrhea, constipation, piles, etc., all of which are not generally discussed topics. And along with that, there has been a myth that the condition is connected with the mind/soul rather than with the body, i.e. it is named as a psychosomatic disease. Most of the patients undergo only mild symptoms. Unusually, they have any severe symptoms. But as a result of stress and depression which follows this syndrome, people find it subdued as more painful than what they should actually suffer. The only best thing about IBS is that it won't extend further, worsening the situation or condition unless and unlike an ulcerative colitis like Crohn's disease. IBS does not end up to alterations in the tissues present in the bowl nor will cause any inflammation. It won't contribute to one's sensitivity to colorectal cancer. As a result of which it does not require any intensive treatments. Instead, it can be cured with changes in one's usual lifestyle, intake of food and stress. Let us check out some methods to tackle irritable bowel syndrome. Several people undergo stress when they have irritable bowel syndrome sets on. However, biofeedback has helped people for several years. This type of stress-producing method will help in decreasing the tautness of the muscle to ease a much lesser heartbeat with the measurement of feedback by the machine. You will then be brought down to a state of relaxation which will help you deal with the tension of undergoing the syndrome. Yoga like power yoga, meditation etc. also can develop as elementary support. Also, a usual massage appear convincing. Inhaling maximum air, thus breathing deeply, will help in muscle relaxation. Most of the youngsters breathe from their chest, which needs to be corrected. The lungs along with the diaphragm are meant to be filled in with air and released from air fully. The diaphragm is just an outer border made of muscles and which limits the abdomen and the chest. Whenever breathing becomes proper, the abdominal muscles will relax, which helps in making the motion of the belly normal. In some people, the changes corresponding to the diet will help to inhibit the symptoms of irritable bowel syndrome. Though the body may not be in a ready state to respond, you will achieve your objective in the long run. Slowly try to increase the intake of fiber content over a selected week. It will become a Thanksgiving for people suffering from diarrhea and constipation. As IBS has both symptoms, it will also deliver some alleviation for the syndrome. If your condition does not improve with the intake of vegetables, whole grains and fruits, you need to consult a dietitian. One of the suggestions of the syndrome is to refrain from those foods which cause trouble to you. These involve dairy products, chocolate, sweeteners, caffeinated beverages, alcohol and drinking sodas. Some people would be hypersensitive to certain kinds of foods. It is better to conduct some observations to know which all trigger the attack of IBS. For nearly all people, the foods fat-rich like margarine, mayonnaise, cream, red meat, butter, nuts, ice cream etc. are the main food items that cause this syndrome. But try to be cautious of your diet, as it should leave you undernourished. So don't have too many restrictions.